Welcome back to Western New York Tonight. It's a live call-in show, 434-1733. I'm Tammie Lee Demler. I'm with the Pharmacist Society of the State of New York, and I'm your host tonight. And we're very fortunate to have Professor Fred Bennes here with us from the University of Buffalo School of Pharmacy and Pharmaceutical Sciences. Fred, we were talking before our break about cold versus flu, symptom relievers and such, and I'd like to get back to that. But before we do, I'd like for you to tell us a little bit about the new requirements. At the beginning of the show, you were speaking about the PharmD program now and the fact that you're a professor in that program. Tell us a little bit about what it takes to become a pharmacist. I think our viewers might be interested in knowing the person behind the counter, getting the medications ready. What do they have to do to be a pharmacist?
Well, pharmacy education, since I have been here in 1974, has definitely changed, and in the preceding 30 years it changed. It's now a 6-year program. It's 4 years of professional training and 2 years of undergraduate education. The interesting development in the last couple of years is we're admitting almost no one after 2 years. Almost all the people who are being admitted now already have a degree in something else.
Oh.
Most of them Bachelor of Science, some of them even have master's level degrees.
Mm-hmm.
And then they come into a 4-year pharmacy program. So that's 8 years of education for the general case. That's quite a bit. And for people who spend 1 or 2 years after graduating doing internships and residencies, there's a lot more education that's going into pharmacy now.
Mm-hmm.
It's still less in terms of number of years of that goes into medicine, but it's actually getting closer to it.
Mm-hmm.
The reason for this is the demands for the knowledge demands for the person who can serve as a pharmacist are really expanding. People aren't necessarily getting sicker, but people are using more medications. There's an increase between 1992 and 1998, the number of prescriptions dispensed doubled. Between 1998 and 2005, it doubled again. So compared to 1992, which is in most of our recent memories,
mm-hmm.
we're now doing 4 times as many prescriptions. We do not have 4 times as many pharmacists. As a matter of fact, we barely have, a few percentage more than the number of pharmacists we had then. So the amount of that work has gone up. Secondly, the things that the pharmacists are expected to do with the consumer have gone up in terms of talking to them, offering them information. It's all about information transfer.
Mm-hmm.
Thirdly, the medical community is relying more on pharmacy to keep track of the meds that are being prescribed from different practitioners, to match all of these medicines up with interaction tables that say you can't take this medicine and this medicine together.
Mm-hmm.
Wow, the number of drugs being dispensed, the number of new drugs that are there is really growing quickly. Even a pharmacist can't keep up with
mm-hmm.
it. And certainly people in medicine are burdened by this increased growth. So we need practitioners with increased competence to be able to hit the ground running, to be able to manage these this ever-increasing
mm-hmm.
complexity.
So number of drugs increasing, new novel treatments, patients living longer, probably on more drugs per person than before to manage chronic diseases. I mean, because that seems to be, the way of our world with increasing obesity, diabetes, the whole metabolic syndrome.
That 4-fold increase since 1992 until now, there has not been a corresponding 4-fold increase in number of people taking prescriptions. So that means that people are taking more drugs.
Mm-hmm.
Each person is taking more things. Is that a good idea? Sure, because the newer drugs are available, but probably more of an influence or more of a factor is where there's more understanding about how to manage different conditions, and we're managing them with more drugs.
Mm-hmm.
Hopefully we're managing those conditions more successfully.
Mm-hmm. What would you say for people out in our viewing audience who may be considering pharmacy as a profession or healthcare in general? Would you say that's a great field to be involved in at this point? I always advocate because obviously the need will never decline. If anything, it'll just increase. But for those out there who are wanting to potentially get involved in the healthcare field, pharmacy I'm always advocating for. What is your philosophy?
Oh, pharmacy is very lucrative to be in right now. Pharmacy pay has gone way up. It's gone up faster than just about every other health practitioner's pay. And that's because the amount of demand has gone up. It's not because the medical community decided to reward pharmacists for being wonderful people. But that's the main reason it went up. There's no reason to suspect that demand is going to decrease. People are getting older. People are going on more medications for the number of people that are around. Wow, that's growth. How many industries right now where the pay is good is there growth? Maybe not as many as we would all like to have. So, wow, if I was considering a health field, pharmacy would be great right now.
And that's really a nice thing for you to be able to say as you're almost leaving the practice, going into a new mode of retirement.
Yeah, new phase of my life.
A new phase of your life.
Sure.
I would say, too, when I'm advocating for a profession, trying to mentor students to consider pharmacy, I always indicate that it's a challenging field that has limitless opportunity. You know, certainly pay, you're looking at pay as a good perk, but it's quality of your career satisfaction too. And with pharmacy, I think you can almost go in any direction. You can work for this government, you can work for community pharmacy and make wonderful interventions, academia. What is your philosophy as far as practice setting? I mean, do you advocate beyond academia? I mean, what do you think academia has been good for you?
You forgot research. Yeah.
Research, that's huge.
Lots of research, and even marketing. Drug companies really like pharmacists to go out there and help talk about their drugs. With people taking so many more medications, and with health practitioner time being squeezed, we need more people who are capable of paying attention to what's going on, and more people who are out there spreading the message and transferring needed information to patients, to customers. We need the customers to be interested in that information. We need the pharmacists to be even more motivated to transfer that information. And it's kind of a collaborative thing. It's not just someone sitting there and the pharmacist reading off a script. You know, it's discussing what you're taking and how to take it and when to take it and how all the things fit together. This same collaborative experience goes on between the physician and the pharmacist too, or the prescriber and the pharmacist, I should say. That is beyond what the traditional pharmacist did 30 or 40 years ago. Pharmacy has been evolving that way. Most pharmacists who are practicing right now have been growing with that, but the intensity will only increase, and it may increase quite a bit because we need this information resource available in the community and this information source acting with people if we're going to get things to work out. Look, we have lots of good therapies out there right now. You mentioned hypertension. Hypertension is so simple. We know that if your blood pressure is up, that if you don't get it down, you will have not good outcomes. And if you get it down, you will have better outcomes. And furthermore, it's easy to get it down. You do this and this and this, and it comes down. It's really, it's much easier than losing weight. But in spite of that fact, the medical community is not succeeding. We all know what to do, but we're not succeeding. We have less than 30% of people controlled. Something's not working. Pharmacy needs to be an important part of that. Medicine needs to be an important part of that. The consumers need to be an important part of that. We need to do better than we're doing right now.
Where do you think the weakness is there? Do you see it as a drug availability? Could it be costs of medications? I know Medicare D, the big elephant in the room, that's been a mixed bag of blessings for some. Medicare D offering some relief to those who have absolutely nothing, but causing some community chaos for seniors who aren't sure where to go. I know I've had a lot of community outreach as it relates to Medicare D? Do you think it's an issue of patients not being able to afford the medicine that is available?
Well, cost is certainly an issue, and there are very expensive hypertensive therapies, but there's also very inexpensive hypertensive therapies. And a pharmacist and a physician can work together and come up with a great plan to help that consumer be able to afford it. Mm-hmm. There is an affordable solution for everybody, and for those who have absolutely no resources, we do have Medicaid, and Medicaid is wonderful in that respect. Mm-hmm. There are things that we can do about costs. I think that if you ask most health practitioners, they will say that I tell my patient what to do, but they just don't do it. Well, that may be true, but if the patients aren't doing it, then maybe we're not telling it the right way. Mm-hmm. Maybe the pharmacists and the physicians need to get more involved to do this differently than we have been doing it before, mm-hmm. and to help the consumers be more motivated. And it's not just motivation, there's issues of side effects, but there's not issues of effectiveness. We know what to do, it's easy to do, and we can find a solution for everybody, but we have to work with them. All three of those parties have to be working at it. Mm-hmm. Prescriber, prescriber, pharmacist, and consumer.
And it may not be necessarily adding a new medication. It might be taking something away, streamlining the way it's taken per day. I can tell you, being a patient in cases of where I'm taking an antibiotic, or the mother who's caring for the child who has to take a medication, you have to realize that after a certain number of days, it's hard to comply or to be adherent to that medication regimen. I can imagine for a chronic illness where you're taking medicine every day with multiple medications involved, that gets very, very complicated.
You have to put together a plan, and that's what pharmacists should be able to do. Mm-hmm. And a lot of pharmacists can. The new pharmacists are getting specific training in that, mm-hmm. and hopefully will get better and better and mm-hmm. better with it.
And specializing. It's not just one pot of pharmacy practice anymore. People are kind of breaking off and doing their own little specialty areas.
It's very analogous to all other practitioners.
It's really an exciting field to be involved in.
It's pretty neat.
As we're getting ready to close tonight, I just want to thank you very much again for being my guest tonight. I would say for the viewing audience that the most expensive medication is one that's not taken correctly. So you should use your pharmacist certainly as an advocate for you, a health professional that can work with your physician to make medications work for the best of everyone. So we thank you for joining us tonight, and we will see you next week.